One. Okay, so the next thing we're going to talk about is urine collection. This could be done from an external exam where you feel the lower abdomen and continue in a downward direction till you're approaching the inguinal regions on either side, but still at the midline, and you feel the pubic bone. If you take a large bore needle and insert it just over the pubic bone, you should end up within the urinary bladder. And as you aspirate, you'll start to collect urine in the syringe. Sometimes, if the bladder isn't largely expanded, you might have to go back and forth to either side and perhaps in the lower abdomen. If you aspirate anything other than yellow fluid, you might have gotten into the bowel, and that sample would not be good anymore. So that's for collecting a urine sample from an external exam. In an internal examination where the organs are examined, you have a Y-shaped incision and the abdomen is open. And in the same region of the body, just tucked into the pelvic region, you would have the bladder located in the anterior aspect. You can aspirate urine directly from the bladder, which is a cleaner technique. There's less likely the chance of contamination with blood and other fluids from that region. So you would just insert the needle into the urinary bladder, aspirate, and you'd have a good urine sample. In some circumstances, if the urinary bladder is very dry and there's minimal amounts of fluid, you could actually put sterile water in the bladder and do bladder washings, which could yield some results. The urine is a very good sample because it's reflective of earlier phases of the intoxication where substances are either in very low levels in the blood or not even present anymore. If the person is to drift off into a coma and have a delayed overdose, you might only get the insulting substance in the urine and not even in the blood anymore. So it's a very good sample to collect and submit.